My name's Perineal, and I'm going to be showing you how to give a bed bath to your patient. So the first thing we're going to do is we would have knocked when we came into the room. We always hand sanitize as we walk into a room, and we would introduce ourselves to our resident. We refer to them as residents when they're in a nursing home and patients when they're in the hospital. When you're introducing yourself to your resident that first time, always check their armband to verify you have the right person. And if they're not wearing an armband, always ask them for their full first and last name. So I'm going to explain what I'm going to do. Now you're going to find that a lot of your residents are going to tell you no. When you ask them if they want a bath, they're going to say no. So what you might want to do is say, would you like to take your bath now, or would you like it in an hour? And if they say, oh, in an hour, then in an hour you just come back and say, okay, it's time for your bath. And they'll just say, okay. Most of them will just say okay, and they'll let you get them cleaned up. If they say, no, I don't want a bath, then you can say, well, would you just like to get freshened up? Because by the time you do a partial bath, that's freshening a person up. So there's different ways to word it to get your patient to get clean. Now, in the nursing homes, most of the residents take showers twice a week. And so on the other days, we're at least going to give them a partial bath. What I'm going to show you is a full bath. In a full bath, we start with the eyes and the face, and we work our way all the way down to the toes. But a partial bath, you do the eyes and the face, the hands, the underarms, the back, because it gets kind of sweaty, and then the perineal area. You don't have to do the legs, the feet, this part of the arms, or the front part of the torso. So I've already introduced myself and asked if it's okay to give them a bath, so now I need to go get my supplies in the linen cart. So in the linen cart, we don't wear gloves. We should have clean hands though when we're in the linen cart. The linen cart will have a cover on it. You always pull the cover back. So I am going to need a bath blanket, a waterproof pad if they don't have one underneath them. I am going to need a towel to drape my work surface, a towel for the front of the perineal area, the back of the perineal area, to drape the body part I'm washing, and to dry the body part I'm washing. So quite a few towels here. So I ended up with 5 towels. I need 4 towels for when I get to the perineum, or 4 washcloths, I'm sorry, when I get to the perineum. 1 when I do the eyes, because that's an opening to the body, and then 1 for the rest of the bath is usually fine. Now this is if I'm giving the bath by myself. If I was giving the bath with another person, I actually only need 1 more washcloth and 1 more towel to make this work. And then I'm going to need a clean gown. Now most of the time in the nursing home, we don't put them back in a gown. They will actually get dressed in their regular clothes. We carry the linen away from our body. Your uniform would be considered dirty. So when I get over to my work area, I'm going to go ahead and I'm going to drape my work surface. I have clean supplies on one side and dirty supplies on the other. I kind of just stack them in the way I think I'm going to need them. The other thing I'm going to need to get is their bath basin. And if they have bar soap, I would get bar soap out. If they don't have bar soap, a lot of the facilities use liquid soap. I'll get a cup and put liquid soap in it to use. And I think that's everything I need. Now I would pull my privacy curtain all the way around. I'm going to leave that side open so this can be filmed. And I'm going to go get my water. So I'm going to go get my water. I tend to get it a little to the warm side. If the patient tells me, oh, it's way too hot, I'll go put cooler water. And if they tell me it's just a little too hot, I'll say, okay, I'll let it cool off a little bit. Because by the time I get everything set up, it's usually cooled off fairly well. I'm going to always have my patient check the water temperature as well to make sure it's okay for them. And now I'm going to go ahead and get my gloves. Just reaching over here. I would recommend that you always keep some extra gloves in your pocket, especially if something like if you're right in the middle of a bath and you tear your gloves. It's always nice to have an extra pair of gloves in your pocket because you always want to wear gloves when you're cleaning a person. So I'm going to raise the bed up to a good, comfortable working height for me. Now, if I was doing this bath with another person, I have to bring the bed up to the highest position for the shortest person. So if you're tall and your partner is short, you're going to bring it up as high as the shortest person can tolerate it. If you're giving this bath by yourself, you can bring it up as high as is comfortable for you. Now, it will depend on what I'm doing as to how high I bring the bed up. If I'm lifting someone up in bed, this would be too high. I like to be able to bend down and lift up. But if I'm giving a bath, I like to just do this instead of having to bend over. And you never want to work over a rail, so put this rail down. That rail has to stay up because it's away from you. I'm going to go ahead and cover my patient up with my bath blanket. Now, the first few times you give a bath at the facility, you will have a partner probably. You will not have to do this by yourself. But you'll find that unless your patient can't move or turn, you're really giving a bath by yourself really just, it doesn't take a lot of time once you get used to it. So I'm going to take their gown off of them. And again, I just want to always think about warmth and privacy as much as I can. You don't want to, this doesn't normally happen on a real person, but somehow on my mannequin, this gown got tangled up in the joint. Now I can put this on my dirty side or actually stick it straight into a soiled linen hamper if there's one in the patient's room. If there's not a waterproof pad underneath him, I can put that under him now. Even though I'm not ready, even though I'm not going to start with peri-care, I can go ahead and do that so I don't have to do it later. You can just ask your patient. You'd be amazed at how many of them can lift their bottom up for you. Otherwise, you roll from side to side to get it out. When I take it off, I'll roll them so I can show you that. Okay, so we're ready for our bath. So we're going to start with our eyes, and obviously we would not want soap in the eyes. I am going to drape my pillow so I don't get my pillow wet. So you can do a mitt technique or a four corners technique. Four corners, I'm going to start with the inner corner. You go with inner eye out, and usually you wash over it twice, because if there's crusty stuff in it, it takes a couple times to get it out. Now, that was a four corner technique. Now let's rewind, and if this was clean, I'll show you what a mitt technique would have looked like. If I was doing a mitt technique for the eyes, eyes are an opening to the body. So I go inner corner out, inner corner out, inner corner out, inner corner out. Now, because this is an opening to the body, I get rid of this washcloth. Now, some instructors feel that's kind of wasteful of a washcloth, but you don't always know if they have any infection or anything going on in their eyes. And since that is an opening to the body, you don't want to carry that to another area. So I get rid of it. My next washcloth, I'm going to use for the whole rest of the body till I get to the perineal area. So I always ask my patient if they like soap on their face. Some people do, some don't. So we'll make it easy for ourselves and say that they don't. So I'm just going to go ahead and wash the face. You always wash gently. And I get behind the ears. We don't stick things in the ears. You know, we don't do Q-tips or anything in those ears. And I like to just kind of get behind the neck too. So that one, there was no soap on that. So this was the towel I'm using to drape. So now I'm going to go ahead and I'm going to dry. And we always pat dry. Okay, and I'm going to continue to use this one. All right, so now we're going to come down the body. So I'm going to take this out. Now, I honestly don't remember if your book says to do the far arm and then the chest, or the chest and then the arms, and I don't really care which way you do it because it's not an opening to the body. Now, as far as reaching across a person to do that far arm, I'm fairly tall. I have a long arm reach. If the person is not overly large, I can usually reach and do this arm. If you're shorter though, what you would do is you would do the chest and the arm and the leg on this side, and then move all your equipment over to the other, put this rail up, move your equipment over to that side to get that other arm and leg on that side. Okay, so I'm gonna go ahead and just drape underneath this arm. Now I have to be honest, I used to not be as careful about draping under a patient when I was washing them. I put some soap on. Now I'm not dealing with an opening to the body, so there's not a special technique I have to use. I don't have to use a mitt, I don't have to use four corners. I can just go ahead and soap it up. But what I started to say is, I used to not be so careful about draping under a body part when I was washing them, but because I figured I was just going to change the linen anyway when I was all done with the bath. But one day I was giving a bath and wasn't really careful and getting the bed wet in the process of giving the bath, and a patient in the room next to me was having trouble and had an emergency, and I had to leave my patient unfinished with my bath process and my bed change, and I ended up leaving him in a wet bed, which is never a good technique. Now, this washcloth that I put soap on, I am now rinsing that soap off in my basin, squeezing it out, and now I'm rinsing with the same washcloth. I'm going to use this same washcloth for the entire bath until I get to that peri area. So one towel to drape, one towel to dry. Now, if I was giving this bath with another person, then because I'm doing half the body and they're doing half the body, we could each just have one towel and you could drape and dry with the same towel. So now I'm going to bring it over to this side, drape my area. And I'm going to tell you, your first bed bath might take you a little while. Usually my students, their first bed bath, it probably takes them, I don't know, 45, 50 minutes for that first bed bath. And the second one is going to take you about 30, and the third one's going to take you about 20, and you'll get to where you can do a complete bed bath in 10 to 12 minutes, okay? But it takes practice, and that's one of the reasons why we're there in that at the facility, is to continue to practice. And now we'll pad dry. Okay, so now when I do the chest, your book says to actually cover the chest up, and it says to lift up and wash like this without overexposing them. That is great in theory, and for a male patient that will probably work fine, but for a female patient, especially if they have larger breasts, you're going to have to expose them because you're going to have to lift up under the breast to get underneath them. So when I do the chest, I am going to have to lift up on the breast and come underneath them. Now when you're giving a bath, one of the things you're doing is you're always looking for anything abnormal. So these we'll learn in another class, or colostomies. But if you notice, we have a reddened area under here. So anything where the skin doesn't look right, where there's rashes, there's blisters, there's reddened areas, we're always going to make sure we report that to the nurse when we're done. So now, again, same water I'm using. I'm going to rinse this off. So I frequently get asked, when do I need to change the water? You're going to change the water if it gets too cold, if it gets too soapy, or when it's time to do the perineal. And now we'll pad dry. Okay, so at this point I have a couple options. I can do the back, I can roll them over and do the back, but because I'm gonna have to roll them over when I do the bottom, I tend to do the back at that time. So I usually come down and do the legs. Some people will do the back and then come back and do the legs. So I'm leaving the back of the perineum still. So now I'm gonna come and I'm gonna do my legs. Same washcloth that I've used one washcloth for the eyes, and I've got one washcloth that I'm using for this whole rest of the bath. So with soap, this is going to slide up nice and easy for your patient. You're going to get in between those toes, and then we're going to rinse off. And I can instead, I mean, I'm talking to you guys, but normally I would be talking to my patient. It's nice to have a conversation with your patient. So we pat dry, especially with our elderly because they have very frail skin. Make sure we get in between those toes. And now we're going to come to our other leg. So if I was giving this bath with someone else, I told you I only needed one extra washcloth, really. Actually, I probably don't even need an extra towel, just an extra washcloth. Because what I would do is I would just drape and then dry with this same towel. If I'm doing the entire bath by myself, this towel's going to get too wet doing that. But if I'm only doing half the body, it usually works fine. So this has soap, so I put some soap on here. Now we're going to wash this other leg. Long, easy strokes. Baths are really good for a patient. They help keep the skin clean so they don't get infection. It helps promote circulation. It just gives them a good feeling, a sense of well-being. If you've ever gone camping and you haven't had a bath in a couple days, you know what I mean. It's not very comfortable. So now we're rinsing the soap off. Okay, so we've washed everything except the perineum and the back. So now this one's gonna go in my dirty side. Have it dry. Okay, so now I have to change the water. Now because I'm by myself, that means I have to put the patient down. And I'm gonna save one of my towels. Save one of my towels because I'm still gonna use it for the back. And I should have saved my washcloth too. Actually, the washcloth I told you I was gonna put on the dirty side, I actually just kind of tuck it right here. I don't actually stick it in the dirty pile, I tuck it right there for when I'm ready for the back. Okay, so if I was doing this bath with someone else, I could put the rail up, go get the water, but leave the bed in an up position because I have the person, another person giving the bath with me who's here. But if I'm doing this by myself, I have to go ahead and put the rail up, put the bed all the way down, and now I have to go and dump my water, clean my basin, get fresh water, and then come back and set up for perineal care. So it is a little bit of a hassle in that respect. So I'm gonna go ahead, dump my water, clean my basin, get some fresh water. I can check the temperature, they can check the temperature, and then we're gonna go ahead and get them set back up now for the perineal. Now I should still have 4 washcloths here, and because once I do perineal area, nothing dips back in here, I can put all 4 washcloths in here, in this basin. Now this time, I know I already showed you a video on just doing perineal care and changing a brief. This time I'm not going to worry about a brief, but what I did do is I put male body parts here this time. So I like to make sure he's covered up here. And again, we can do that triangle technique I talked about when we did peri-care, or I can go ahead and pull this up. We just have to provide warmth and privacy for this patient. So this time I have a male body part. Now, there is a little bit of difference. A lot of this is going to depend if the male has been circumcised or not. If they have foreskin still over the tip of the penis, we're going to have to make sure that we retract it to be able to clean in there. So, and that gets a little bit tricky, but it's not too bad. So we go ahead and have him set up with my 4 washcloths. And I actually like the 4-corner technique for a male a little bit better personally. Excuse me. So here what I would do is, and this is going to get a little bit tricky because this male has not been circumcised. If they're circumcised, it's much easier, but I'm going to have to retract the foreskin. I would retract the foreskin, and I'm going to come around this tip. Now I'm going to go ahead and just set this down right here because I have to rinse this tip off even before I go any further. So now this gets a little tricky with my washcloth. Now I've got this and I have to dry the tip off because now we have to retract that foreskin before we wash the rest of the penis. So you have to soap you have to pull the foreskin back, you have to soap the tip, rinse the tip, dry the tip, and then you pull the foreskin back. I wouldn't have had to done that step if they had been circumcised. So now this washcloth here that still had my soap on it, I'm going to go ahead and hold the penis up, and now I'm going away from the tip. The tip is what I'm trying to protect. So I'm going down the shaft of the penis away from the tip. It's really just the tip I have to protect for the male. The next one here, I'm going to get the scrotum. And the next one here, I just kind of get in the folds here. It's really just the tip that I have to protect. A little different than it was for the female. So now this is going to go on my dirty side. This other one that I was rinsing with, I'm going to go ahead. I used that first one to rinse the tip off already, so I'm going to use this one to rinse the shaft off of the penis. The next one to rinse the scrotal sac off. And the next one to get the folds of the legs. Where with a female, every stroke I had taken from top to bottom was a new part of that washcloth. So now I'm going to go ahead and finish drying the front off. Now, if a lot of times with your elderly residents, this isn't going to be an issue as far as a male having an erection, but some of your younger patients that you might take care of, you may be getting them cleaned up and doing perineal care, and they may get an erection. It's just a normal physiological response. They're not trying to be fresh or a pervert. They're probably going to be just as embarrassed or more so than you are. So just be professional, finish up, and when you're all done, give them some privacy and it'll be fine. So then we're going to go ahead and have them roll over. Okay, so again, I'm trying to protect warmth and privacy here. It's a little hard on a mannequin, but we'll do the best we can here. I'm going to do my four-corner technique here for the bottom. Again, we cleaned to the end of the scrotal sac, so now we're going to come up. This will go to the dirty side. I don't know if you see this reddened area right here. That's the beginning of a pressure ulcer. So this again is something that you would want to make sure that you report to the nurse. So now I'm going to rinse that soap off of the bottom. And that'll go to the dirty side. And I have my towel here. That's going to go to the dirty side. Now, what I have left here is the washcloth and the towel that I had been cleaning up with that rest of the bath. This bath water is still clean, and I have not done the back yet because nothing dipped. I cleaned that. I got fresh water for the pericare, and nothing dipped back into it. So this is clean water. So now I'm going to take that washcloth, and it's warm water. So I'm going to rinse this off really good and get it warm again. Rinse it out. Put some new soap on it, and now I can wash my back. And with that towel that I had from earlier, I can just drape it here so I don't get the bed wet. And now I can go ahead and rinse my soap off. So pericare never dips back in, but the rest of the bath you can. Rinse my soap off. Dry. And we just gave a complete bed bath. So now, before I roll him over, I can go ahead and take this out. Now, if you have a person who can't lift their bottom up, you would roll this out from underneath them, have them roll over, and then just finish rolling it over. And if they're really large, you're gonna need help. You know, if you have someone who's really large and can't bend, can't move, can't turn, you are going to need to you're gonna need help. That's all there is to it. You can get the front part yourself, but you're gonna need help for the back part. So now I need to get them dressed. Now normally in the nursing home, if you're working in a hospital, the patients just get back into a nice clean gown. If you're working in a nursing home, you've let the resident pick out the clothes that they want to wear for the day, and we're gonna get them dressed for the day into regular clothing. So. Now, if your resident doesn't have a weak side, it doesn't matter which side you dress first. But if they do have, like if the right side was weak, I would have put the right on first and then the left side. So you dress the weak side first. But if they're equally weak or they're equally strong, then it just doesn't matter. And then I'd go ahead and tie this under behind them. So I'm all done with my bed bath now. So I'm gonna make sure the covers are pulled up nice and neat. Put my rail up and drop my bed down. And now I want to get rid of all these supplies while I still have my gloves on. And again, if I'm concerned that I contaminated this rail, it's really easy to just get some Sani wipe or some Sani cloths or a hand sanitizer on a paper towel and just wipe it off. So I'm going to go dump my water, clean out my basin, dry it, put it back where it goes. My cup of excess soap I'll just throw away. And then this here, I'm going to put into that bag we talked about earlier when we did pericare, or into the linen hamper. So we would put this in the dirty linen hamper, or we would put it in a bag. And I don't have a dirty linen hamper, so that's going to be my hamper right there. And now I'm going to take off my gloves. So when you take off gloves, you want to make sure, again, we're going to pinch here, then come underneath, goes into the garbage, and then we're going to wash our hands with soap and water, or we can hand sanitize at this point. And then I always, again, before you leave a patient's room, just do a good safety check of the room. Is the bed in low position? Are the rails up? Can they reach their colite? The stuff that they normally want, is it right here beside them? And do they need anything else? And then I'll pull my privacy curtain back and we are all done.